All right. Shalom, shalom. This is Sister Oslin from the UK. And today, let me find it.
Can you put your, we can see your chin and your neck.
Oh, it's just, can you see me?
Yes.
Okay. Sorry about that. Right. So today, it's presenter for our spiritual, physical, emotional cleansing training is Dr. Santy Kit Ling Lee. All right. Bear with me. Okay. She has earned a PhD in clinical psychology at a California university. Her postdoctorate study, bear with me, sorry, it's a bit difficult. Study is on brain health and brain, what is that? Behavior. She is an American clinical marriage and family psychologist. She has also received certificates from a college of nutrition in Toronto. All right. Toronto. Right, so what's going to happen today is that you can find her talk from 11 to 52 at her YouTube channel called Messianic Healing. You can also find talks 1 to 10 at House of Israel UK. Today's talk, right, sorry, give me a moment. Today's title of the talk 53 is depression, or depressive, I should say, disorder, physical, what is that? Physical view, I think it says. Physical view, yeah. So with that in mind, let's welcome Dr. Santy Kit Ling Lee. Thank you.
Hello, everyone. I'm happy to see everyone here. I present this talk in David, bottom of the mountain in Panama. I'm so happy, the province of Cherokee, in my friend's house. Today's talk is 53 depressive disorders from physical view. And this is 53 talks. My talk number 1 and to 11, you can find it from House of Israel, UK. Pastor Marcus encouraged me to do the talk. Okay, let's do the talk 53 now. A depressive disorder from physical view. According to Diagnostic and Statistical Manual of Mental Disorder, 5th edition, Depressive Disorder, excluding the bipolar disorder, because in the past, a depressive disorder in other version of DSM include bipolar, but this time DSM-5 not include. So DSM-5 this time include the following types, and I give you brief description. The first time, descriptive mood dysregulation disorder. This disorder is usually not people ignore or not pay attention, but you will find out what's it about. Disruptive mood dysregulation disorder means severe temper outbursts, including verbal and physical violence, aggression for at least a year. If that person keep doing it, he may have disruptive mood dysregulation disorder under depressive disorder. The second type, major depressive disorder, daily depressive mood or loss of interest, ranging from mild to severe for at least 2 weeks. People usually heard major depressive disorder. The third type, persistent depressive disorder. Another name is dysthymia. I remember my research on this topic. Chronic depression lasting for at least 2 years without manic episode. So always depressed, not hyper. The next one, the fourth one, premenstrual dysphoric disorder. Mood swing, sadness, and fearful in the week before menstruation. I don't think men can have it. Okay. The second one, the next one, substance or medical induced depressive disorder. Depression resulting from substance or medical use. Another type, specified depressive disorder, recurrent brief episodes of depression lasting at least 13 days or insufficient symptom to qualify full criteria. Unspecified depressive disorder. This is the last one I want to introduce you. This type is called unspecified depressive disorder. Usually the psychologists or psychiatrists, they couldn't find anything specifically qualified from the above type. They would say symptoms do not fully meet criteria for other depressive disorders. Let's look at the common feature of depressive disorders. It means sad, empty or irritable moods, suicidal thoughts, fatigue, significant changes in appetite. Either you eat too much or don't want to eat, or eat little. Sleep disturbance. Either you sleep too much or don't want to sleep, or sleep for a few hours. Weight gain or weight loss. Concentration, hard to focus. Slow down mentally and even physically. Retardation, you just feel like don't want to do anything. Such a condition affect daily functioning. Okay. I mentioned on my talk 23 mood disorders. If you go back to listen to my mood disorder number 23, I include mood disorder, the following thing: persistent mood changes that impair daily functioning. Mood disorders include different disorders. They include depression, anxiety, suicidal thoughts, schizophrenia. All these things, sometimes it coexist with developmental disorders, and also sometimes coexist with personality disorders. Okay, mood disorder can arise from various factors, including upbringing and damaging life experiences. Michael Lyon and Dr. Howard identified several key elements leading to the mood disorder. Number A, antecedents that include genetic predisposition and nutritional and emotional deficits. So you see a physical, emotional aspect connect each other. Number 3, to be triggers. What triggered depressive disorder? Environmental factors such as allergies, or you have allergy, growing nose, and couldn't sleep well, make you depressed. Impaired indigestion cause depressed. Cause you feeling depressed. And also hormonal imbalance and blood sugar issue like high blood sugar or lack of or too low blood sugar can act as a trigger for mood disorder. Number 3, mediator. The functioning of your brain neurotransmitter and critical nutritional insufficiency, like if you lack of the main vitamins, lack of minerals, lack of essential fats like omega-3, omega-6, and essential amino acids. Those things play a significant role in mood regulation. Okay, so how come this person always angry, always outbursts, and may that person lack of those things? Depression can be treated from both physical and emotional aspects, particularly once the underlying causes are identified, since the body can and mind intricately be connected. Today, I focus on physical aspects of this question. We'll divulge into physical causes outlined above and explore these the contributions to the disorder in detail today. Let's look at physical factors of depression. Major depressive disorder is characterized by mood disturbances and a loss of interest or pleasure. Look at Hogan's description of two major things: feeling miserable, unmotivated, don't want to do anything. And he highlight why either depressed or the unmotivation, because such depression caused by two major neurotransmitters. Left-hand side is serotonin. Serotonin is the key neurotransmitter. Serotonin regulates mood, okay, depressive mood or happy mood. And right-hand side, dopamine. Dopamine includes influence your motivation. Dopamine derived from adrenaline or noradrenaline, then from your adrenaline gland. Okay. Remember left-hand side, serotonin. Serotonin introduce serotonin need tryptophan. So you put TS, someone's name Taylor S, okay? So essential amino acid, tryptophan, T, Taylor, produce S, Taylor S, produce serotonin. Right-hand side, dopamine, produce phenylalanine, okay? So phenylalanine introduce dopamine, okay? Phenylalanine introduce dopamine. So Taylor S, left-hand side, PhD, PD, PhD, right-hand side. Oh, those two contribute to major depressive disorder. Phenylalanine can be improved by taking enough vitamin B3, B6, B12, C, and zinc. While omega-3 fatty acids, omega fatty acid 3 enhance serotonin and dopamine reception. Low thyroxine from our thyroid gland can cause symptoms like depression, lethargy. Okay, okay, fine. Can cause, let's go to middle of the page. Low thyroxine from thyroid gland can cause symptoms like depression, lethargy, anxiety, panic attack, irritability, indigestion, constipation. Constipation reflect, your gut, it reflect your mind, your brain. Constipation, poor memory and weight gain. Body temperature below 36.5 degrees Celsius may indicate low thyroxine. It can be corrected by iodine. So take seaweed or chlorophyll or other iodine-containing items, zinc and selenium. High blood sugar often stems from excessive sugar or stimulant intake, resulting in depression. So avoid from taking sugar, especially the man-made sugar. Fructose sugar is okay, not too often, too sweet. Okay, so let's look at the treatment, physical treatment suggestion. There are several things I suggest you to look at it. Number one, supplements. I recommend supplement include 5-hydroxy tryptophan, 5-HTP. I prescribe 5-HTP to people who have suffered from at least 5 years in insomnia, and she found it so helpful. And she called me the next time I saw her. She said, "Dr. Lee, how come I could sleep through the night after 5 years of suffering from insomnia?" Thank you very much, Dr. Lee. Okay, so 5-HTP is helpful. St. John wort, another phenylalanine, tyrosine, vitamin B9, folic acid or folate. Or for those who suffer from high histamine, not good to take folic acid. And vitamin B6. B6 are very important. B6 can be found in many animal meat, especially the liver and the beef steak. Okay, method group in 2 major amino acids, trimethylglycine, TMG, and S-adenosine methionine, SAME. Convert that they can, because they contain methyl group, can convert non-adrenaline to adrenaline to increase the level of serotonin and dopamine. Serotonin can, as I said earlier, is derived from tryptophan, amino acid from food like fish, turkey, chicken, eggs, and beans. Eat more turkey, make you happy. Okay, I suggest the dosage recommended by Whole Food. He come up with those dosage. 2 grams of phenylalanine or tyrosine, 1 gram of both, 1.5 grams of tryptophan, or 150 mg of 5-HTP, 200 mg of SAME, or 600 mg of TMG. The second suggestion would be antidepressant drugs. It's not suggested by me, but I try to compare the antidepressant drug with the natural way. 5-HTP has fewer side effects and often outperforms traditional antidepressant. This person casts. She lists 10 reasons to choose St. John wort over antidepressant drug. Because she discovered St. John wort rarely cause side effect. St. John wort does not interact adversely with alcohol, non-addictive, with no withdrawal syndrome, no habituation, or long build-up period, enhanced sleep, and enhanced dreaming. St. John wort does not inhibit sexual drive. It promotes daytime alertness, without causing drowsiness, no risk of overdose. Okay, number 3, essential nutrition. I suggest you take vitamin B6, B9, B12. Especially B12 mainly from meat. If you always eat meat and not a complete vegetarian, you don't have to worry about lack of vitamin B12. And also take iodine, zinc, selenium, and magnesium. Magnesium, when you take, don't take it with zinc, don't take it with calcium. You have to take it separately. Otherwise, they counteract with those combinations. So take them for treatment. I mentioned in my top 51 on the food sources. Please go to my top 51. I give you exhaustive resources about lacking certain vitamin or mineral, the result, and how to find good sources. Number 4, omega-3 fish oil. You can boost up your serotonin levels. Number 5, limit your sugar, especially man-made sugar, and limit your stimulant. Don't smoke. Reducing intake of sugar and stimulant. Exercise, do exercise every day, 30 minutes of walking or jogging at least 3 times a week. Number 7, natural daylight exposure. Getting exposure to natural light and using full spectrum light bulbs indoors can enhance your mood. Light stimulates the pineal gland to produce melatonin related to serotonin. One method is to sit next to a 60-watt opaque light bulb, turning it on and off for 1 minute at dusk while keeping your eyes closed. Number 8, enjoy nature. Spending time in nature can promote a sense of tranquility. After a lightning storm, for example, the fresh vigorous fresh air can be refreshing. So after rain, you go out to have a walk. Okay, Harvard emphasize combination of biochemical therapy with psychotherapy and counseling can enhance treatment effectively. Just like your left and right hand, you can if you use both right and left hand, then you can get a better result. Okay, excuse me. I want to clean up the screen. Okay, let's look at the conclusion. Treating depression through nutrition can have more benefits than the adverse effects associated with antidepressant medicine, like Prozac, Seroquel, and Lustrol. It is crucial to uplift mood by identifying the physical root causes of depression, or even and also emotional root cause, particularly through 2 major pathways. I said PLS and PHC, right? Neurotransmitter imbalance, hormonal imbalance, and blood sugar levels. Positive outcomes often result from a combination of counseling and physical treatments that promote a healthy interaction between the body, mind, and spirit. However, understanding the physical aspect of depression alone is insufficient. It is also vital to consider emotional and spiritual perspective to gain a comprehensive view of treatment, both emotional and physical and spiritual, and 3 ways. Okay, today talk I advocate that healing depression through nutrition. Addressing the question, I ask you question: why can nutrition facilitate rapid healing of depression without medication? Number 2 question. How can we improve mood and motivation? I guess after listening to my talk, you can find answer. Today, I give this talk based on the following research I draw from. Of course, the number 1 is the American Psychiatric Association produced diagnostic and statistical manual of mental disorder. 5th edition, not 4th edition, okay, number 5th edition, 2013 edition. I draw from Baker Encyclopedia of Psychology by Banner, Dr. Banner. I draw information from St. John Wort, this lady Cass, she wrote this St. John Wort Nature's Blues Buster. Of course, the next one would be excellent book by Patrick Hopper. He wrote this Optimal Nutrition for the Mind. I love his book very much. I hope I can digest his book. The next one is a famous nutritionist professor by Michael Lyon. He wrote a book, Healing the Hyperactive Brain. He's excellent in dealing with attention deficit hyperactivity disorder. I highly recommend this book to you. Okay. I'm Dr. Santy Kit Ling Lee. I attend House of Israel, UK, and Comedy and Yeshua Fellowship. I attend this church in Toronto area, the town, Georgetown, Ontario, for Sabbath worship. You're welcome to join our spiritual, physical, and emotional cleansing training group. If you find my teaching is helpful and you did decide to appreciate me by offering, you can send your offering to Western Union. But this Western Union is located in Panama, in the city of David. So make sure you put down my first name, Santy. First name only Santy. And my last name is Lee, because my passport has my name Santy, first name, last name Lee. Okay, they look at my passport and my Panamanian ID card. I don't put my KL there. Make sure you put down Santy, first name, last name Lee. And you can choose PayPal too. My email address is Dr. Lee Consultation. Capital D, capital L, capital C. C, capital D, capital L, capital C at protonmail.com. Please let me know you send me offering. If you are in Canada, you can email me to my TD Bank. Contact me, my phone, and then I'll give you my TD email address. Thank you very much for your support, your offering. May Yahweh reward you greatly. Okay, good. Let's see. I want to meet with my group. Any question, comment? Let's talk. I am happy to see Joe and Austin is joining us. Well, I guess Austin, I can see your ceiling and your wall. I don't see your face. My dear sister Austin, you make today very wonderful. Thank you so much. And I thank Father for my daughter. She finally helped me to solve my technical problem. Wonderful, wonderful. Okay. Praise Father. Joanne is on her way. She's actually driving. And then Dolores has a medical appointment. But anyway, that's okay. I'm happy to see everyone. I'm so delighted, so excited that I can produce today's talk. Finally, today's talk in Panama. Delora, welcome, welcome. I'm so happy to see you here. And welcome, welcome. Any comment or any comment? Any question? Okay. So unmute your mic. Welcome you, Delor.
Thank you. I just got in.
Wonderful. I just mentioned you have doctor appointment. I'm so happy you join us. Wonderful.
Yeah.
Thank you. Wonderful. I traveled from this morning from top of the mountain to bottom of mountain, from Bogete to David, and I traveled to this house. I'm so happy to see everyone. Wonderful, wonderful. Okay. Anyone want to say something? Give me some comment or question.
Can you hear me?
Yes.
I cannot hear you, Osman. Your mic.
Can you hear me now?
Yeah.
Okay. Hi. Shalom, everyone. Nice to see you, Sister Dolores, that you could make it. What I wanted to ask you, Dr. Santy, because I remember when you was talking about the medical way of treating depression, and you mentioned a few tablets that they would give, and I heard you say Seroxat. Was I correct?
Yeah. Okay. A Prozac. You mentioned about Prozac. That's
Prozac, and another one, was it Seroxat you said?
okay. Let me go back to my note. Prozac, Seroxat, Seroxat, and the third one is Lustral, Lustral.
Yeah, the reason why I was asking because many moons ago, when my children were young, I was in depression, and the doctor had put me on a medication called Seroxat peroxidine. It made the news because the effects of it was so terrible. So I was wondering if it was the same thing, if you understand what I'm saying. Because I know they had it on the news and they had a big thing about it, and medically over here in the UK, they were not allowed to prescribe it to anyone because of the adverse effects it had with night terrors and stuff like that, lucid night terrors and everything. So when you said the name, I was a bit like, oh, do you see what I mean? So is it something that they still administer to people?
Yes. You have to understand medicine composed of lots of chemicals. They are not Yahweh's creation.
I know.
So man-made, you know why? When the man-made chemical go into our body, it just like handcraft our cell DNA.
No. Yeah, I know. Yeah.
The DNA into the cell would be traced. The structure of our DNA traced. That's cause the side effect, different kind of side effect. And sometimes it's not immediate side effect. Not only immediate side effect, it may have long-term mind, emotional, and physical side effect.
Yeah. I became a NHS junkie.
Yeah.
The doctor told the chemist, even if it's on a Sunday, they have to open the door and give it to me. That's how bad it was. So that's why I was shocked that it's still in circulation, because the main complaint was about the night terrors. And yeah, once you go through something like that, I used to just sit with my eyes like that and pray and ask God not to let me sleep again. So that's what I was saying. I know it's man-made, but I'm actually shocked they still got it in circulation.
Yes, yes. That's why I intentionally produced today's talk. Aspect, but non-medication.
Yeah, yeah.
I try to give talks on something that not many people realize and want to wake the world up.
Yeah. But I thought I'd just share my experience with that medication, and it was on the news over
Yes,
here. Everybody, the people that was on it, was really terrible, and I had to get rid of it.
yes. Okay,
Yeah.
wonderful, wonderful. We have 2 minutes left. Any comment or anything? I'm going to set up the prayer time, and also any question, further question we can discuss in second meeting. So we have to realize how damaged if we consistently take medication. Maybe in surgery, in critical condition, we may have to rely on physical treatment. Surgery, like a very acute condition. But for chronic condition, many of the diseases can be removed, can be uprooted, even cancer. Cancer takes 20 years to become cancer. Before cancer would be tumor. It takes many years to develop because of our wrong food intake, our poor lifestyle, and our unbiblical belief and practice. So after our spiritual temple in our body. Okay, why don't I finish this section, and then I'm going to end this meeting and wait for a while. Everyone, please join in with my second meeting so that we can focus on what I want to share with you all. Okay. See you later. Bye-bye.
Bye.
Bye-bye for now.